Now, keep yourselves ready now, okay? Are you all attentive? We are starting a new discussion now, okay? Your ventilation perfusion, it's khalas. Now we are coming to a very interesting area, very easy actually, okay? It's not like ventilation perfusion where you have to think more really and you apply your concepts. It's simply you see yes or no, it's happening like this, okay? Very easy. Some facts are there and you need to put up the facts together. Some of information, mashallah, you already know from circulation. Some of information will be new for you, and in the end, it is not really a big deal. It's very easy, okay? And interesting also. We talked about the mechanics of the breathing and the mechanism of the breathing, how tanaffus happens, okay? But now we are talking about the control of breathing, how our tanaffus is controlled by some areas of the body. Is there any control system or control center موجود in the body which is working to control our respiration? The answer is big yes, definitely, okay? As we begin our life in this world, in this dunya when we come here, okay, when we are born, the very first breath, till the end of our life, our respiration continues really. We are changing our stages of life from maulud to becoming tifl really, and then becoming an adult, adolescent person, adult, and then we are turning middle-aged, becoming sheba, and becoming elderly and elderly, and eventually it's the end of the life. This has to happen with all of us really, okay, because it's the course of life. The respiration is a musalsal process, continuous process, okay? But you observe that you don't do much about it. Do you really do some effort about your respiration? It happens automatically. It's a gift of life given to us by Allah subhanahu wa ta'ala. This respiration, which we have all the time, taqriban all the time, 24 hours a day, 7 days a week, and throughout our lives, this respiration, continuous respiration, it's an involuntary form in which we are not thinking about it and we are not trying to control it or do it that no, now I should breathe better, now I should control it like this, now I am thinking about how am I breathing. Whatever happens, I'm talking to you, I'm eating, I'm sleeping, I'm active, I'm not doing anything, sitting, whatever, my tanaffus, your tanaffus, our tanaffus goes on. Okay, it's a continuous process. This is your involuntary breathing, okay, which is not really according to your control. You don't control it, but something in your brain, some markers in your brain is definitely controlling it, okay? So this is involuntary component of your breathing or respiration. This is one thing. But on the other side, do you have any control over your breathing also? Yes, we also have that gift, hadiyah from Allah, that we can change our respiration or modify our respiration, not for a long time, but we can change it for some time really, okay? And this is called our voluntary component of respiration. Voluntary means our shaur knows about it, our thinking brain knows about it, and our thinking brain can change it. If I ask you to stop your respiration for a little time, you can try and you say, okay, I can do that. So you'll hold your breath and you'll do it like this. After some time, when I watch you, I see a change of color on your face and you say, bas, this is my limit coming, okay? And you are changing, that was it really, okay? So you do it to some extent and then it's over really, okay? A break point comes. So you can control your breathing, you stop your breathing by your brain, voluntary breathing by your brain, but to a limited extent only, okay? Mumkin 45 seconds, mumkin 1 minute. If someone has practiced yoga or some other thing, exercises, then mumkin a little more tawil, but you cannot hold your breathing for like 2 hours or 3 hours or 4 hours like that, okay? So voluntary component is there, we can use it sometimes. If I want to say, no, I want a little more air, I should go out and have more air, I want to breathe more. So for some time, I can increase my ventilation also, isn't it? It's again by thinking. its voluntary component. But how many times do we use this voluntary component really? Very little, isn't it? Okay? Special conditions. If I put you into the water, if I throw you into the water, okay, and you go underwater for some time, the time when you are going underwater, what will happen to your breathing? And you will deliberately stop your breathing at that time really, isn't it? Or if you are swimming and you want to swim underwater, you know, you have to swim underwater from this distance to there, you can't breathe. So you say, okay, I'll stop my breathing for that time, I'll swim and then I'll come back here, okay? I hold my breath. So holding the breath is no problem, but short time, this is voluntary component. So two different things, okay? Is it password there? You have a password here for this one? All right. Thank you, Abdullah. Thank you very much. Nervous control of breathing we will talk about right now. Then we will talk about the chemical control of breathing also. Okay, your markaz is maujood, but this markaz is also influenced and supported by changes in your blood, your chemical changes which are happening in the blood. So your main control of tanaffus is coming from your markaz, brain, right? But this control is modified by or fine-tuned by or affected by some chemical factors also. So you will talk about the nervous control, you will talk about the chemical control of breathing. These are the two main areas that we are going to discuss. And then one statement about the exercise also, we'll talk about that. Okay. Respiratory control. Our breathing, I talked to you that it's automatic breathing, it is controlled by the markaz. We don't do it from here by thinking, it happens at a level which is not at the level of your shaur, it's tahatu shaur, you will say that, at subconscious level, below the level, because you are not thinking about it, but it is happening automatically, isn't it? Okay? So at the subconscious level, this area is the medulla and the pons, yani your brain stem. Okay? That area controls or contains 1, 2, 3, 4 or mumkin little different centers or markers for the breathing. Respiratory centers are maujood. Okay? That is about the involuntary control. Voluntary control, I have already told you, it's coming from cerebral cortex, from your shaur, by thinking. Okay. Respiratory control, it is a complete system. You have some special checking areas or the receptors, sensory receptors maujood, and they sense how much oxygen is maujood in your blood or how much ventilation is going on, your alveoli are working normally or not normally, your blood is receiving normal oxygen and your carbon dioxide levels and hydrogen ions are normal or not, and all this information is given to the brain. And then the brain controls your tanaffus according to the need of the body. Okay? So you have a complete system. Your sensory portion or the receptors, your markers, and the final efferent control which is coming to your muscles to change your ventilation. So it's a complete system. Okay? Sensors means your receptors and the nerves. Afferents are the nerves. Okay? Sensors are the chemical and mechanical. When I say sensors, what do I mean by that? What are the two types of receptors maktoob here? Chemical receptors. Chemoreceptors are the chemical receptors. Yani, you know, you have done in CVS also. Sir? You know about chemoreceptors. Maujood in carotid and the aortic bodies. Remember that? Special. And they control your cardiovascular system. But Shabab, these beautiful little things are also controlling your tanaffus. Okay? Chemoreceptor. And what is the second type of receptors? It means when your lungs are expanding and relaxing, your Bronchi and bronchioles are stretching, your airways stretching. In the wall of your airways or inside your lung, some nerve endings are maujood, receptors are maujood. When you are inflating the lung or you are producing some expansion of the lungs, these are stimulated and they send signals to the Markaz. And then the Markaz does the job for you and it controls it. Did you get the idea of chemical and mechanical? Okay. Your central controller, your Markaz for involuntary system, maujood in pons and medulla. Okay, great, brainstem. But your Markaz for the voluntary control is the cerebral cortex, the higher center. That's easy. Your efferents are the motor nerve fibers which are coming out of your system, the motor nerves, and what are they supplying? Yeah, basically your muscles. Your efferent, in your respiratory system, your efferent controllers are your muscles. You know, the last part which is coming and which is bringing the changes in your system, thoracic cage, diaphragm, thoracic cage. What are these things? These are muscles. Okay? So finally, your effectors, the last parts are the muscles, and your efferents are the motor nerve fibers. Am I clear about that? Okay. Look at the picture. Starting the story from sensors. Okay? Sensors are giving information or input to center, yani Markaz. All right? This is input. Markaz is definitely receiving all the information of all receptors, and now it will analyze like a computer and it will see what to do, increase or decrease or maintain, whatever. Markaz will do everything. Okay? Markaz will send the command or the output to the effectors, which are the muscles. Okay? Input is coming in the form of sensory nerve fibers. All right? Impulses. Output is going in the form of motor effectors or the motor nerve fibers or the motor impulses. Do you all agree with this so far? No problem? Great. And that's it. And then effectors are giving the feedback to the sensors, and the sensors will now change because you are adjusting the system. Okay? Your goals of the respiratory control system, I'm not saying respiratory system in general, you told me about that you want oxygen for the energy, you want acid-base balance and all that things, right, you are, okay? Your respiratory control system, what is the idea of the control system? What is control system trying to do? It is trying to keep your gases normal in the blood. Do you agree with that? To keep the oxygen and carbon dioxide according to the need of the body. Okay? If the need is increasing, the system will try to increase these gases. If the need is decreasing, the system will try to decrease. If the need is normal at rest, the system will maintain it. Very easy. Okay? According to the need of the body. And the system is also working in support, in collaboration with other systems like digestive system or your speech. When you are having kalam, when I'm speaking, do you think that my tanaffus is just same as I am silent? Or will there be some change or adaptation in my? Definitely. Otherwise, I cannot speak, you know that, okay? When I'm eating and food is passing from my mouth into my pharynx and down, do you think at that time my tanaffus is going normally also? No. It has to stop for 1 or 2 seconds when I'm passing it down, isn't it? It has to stop. And then again it's okay, like this. So it changes along with some other activities of the body. Okay? This is the main idea. This is the job of your control system. How to carry on all these activities. Okay? Oh yeah. This is your main center for tanaffus, which is normally controlling your breathing. I'll talk more about that, but this is maujood in your Markaz medulla mainly, okay, and in the areas of the pons. It is receiving so many things. This center Markaz, involuntary control, it is receiving so much of information. Look at the desk of istiqbal. What is it receiving? It is receiving impulses from the higher areas or the higher centers. It is receiving the impulses from different other parts of the body. Yani total information is coming from many parts of the body. Look at that. Okay? It's receiving information from the cortex. Okay? Signals are also coming and they can modify. From the chemoreceptors, yani from circulation, the signals are coming. From central chemoreceptors, they are موجود in brain. We'll talk about these also, and you know about the central chemoreceptors, which you did in the CVS also. Peripheral and central. I don't know if you have done central or not, but peripheral, definitely you have done it. Okay? Lung stretch receptors, when the lung is stretching, the signals are coming. Our muscles and joints. Now, muscles and joints? What do you mean by that? Okay, what do they do? Exercise. Okay. Now, I am doing an exercise. I am trying to start the workout. Okay. And just before workout, okay, I am just warming up myself. I am just moving my body parts really. Okay. And I am not started the exercises yet really. Okay. I am just trying to get ready for that exercise. At that time, when I'm changing, when I'm moving my, clenching my fist, changing fingers and moving some body parts, from that, I'm not really doing exercise at that time. But my joint receptors have now started sending impulses to my markers, and my markers will increase my tanaffus slightly even before I start the exercise. So that this is a preparation. Then when I really start exercise, push-ups or pull-ups or whatever I do, my tanaffus will be controlled very well and oxygen will be easily given to my tissues for the exercise. Okay? So couple exercise, your joint receptors, they even start and they send impulses. Did you get that? Even before the start. During exercise, lazim, no problem. But even before exercise, when you are just moving your body parts, you have seen when the race is starting, they are just doing and they are preparing. They are not standing like this. Okay? They keep themselves ready for something that they are going to start. Okay? 100 meters race is starting or sprinter is starting. So you see that, isn't it? So their joint receptors are sending and their oxygen is increasing in the body, or their tanaffus is becoming a little better at that time. Okay? All right. And some centers from pons. These are the centers from the pons. This is your medulla. And then your respiratory center is controlling your muscles, like diaphragm is the main muscle. Okay? Now, very quickly, I'll go quickly now. It's about the neural control of breathing, Shabab. Okay? Neural control of breathing. Respiratory centers, please. Be careful. I'm giving you the names of centers. It's not Wajed. It's not 2, it's not 3, there are at least 4 main centers which are working together to control the breathing. Okay? One by one, please. Are you with me, all of you? Yes. Great, thank you very much. Okay? Now, this is the picture. Okay? Well, this picture is showing you some centers, and okay, can you see pons and medulla? Upper part pons and the lower part medulla in the picture? Okay, great. I can also see that from here. Well, look at that centers which are present. Some areas are present here. Look at the lower part, medulla. Look at focus medulla. In the medulla, this is the back side. Your left side is the back side of the medulla, and your right side is the front side of the medulla. At the back side of the medulla, there is a center shown with the blue color, blue or banafshi color, you can say that, purple or the blue color which is shown here. What is that center shown? Dorsal respiratory group. Do you see that? At the back side. That's why it's dorsal. Okay? There is another center موجود in the front side, in front of the dorsal. What is that center? Ventral. So 2 centers are موجود in the medulla. One is called dorsal, other is ventral. Dorsal is called DRG. Now I'll call it DRG, dorsal respiratory group. DRG, dorsal respiratory group, DRG. And the ventral is called VRG, ventral respiratory group, VRG. Now I'll use the short form. I'll not say the dorsal respiratory group, I'll say VRG or DRG, like this. Okay? And you will understand that. Okay. Now you go up. Just above the DRG and VRG, there is an area, a very light area, dotted area is shown, and there is a center mawjood. And what is that center? You call it apneustic center. Okay? And if you go above the apneustic center in the pons, there is a red ahmar area. Okay? What is that area? All right. So how many centers are present in the medulla, Shabab? Can you name them? Thank you very much. And how many centers are present in the pons? Just one? Well, this is the beginning of the pons. This is medulla and this is pons. This is pons and this is pons. Now, let me put the question in another way. I want the name of the center which is mawjood in the upper pons. Okay. The center which is mawjood in the lower pons. Thank you. 2 in pons, 2 in medulla. I want the center which is mawjood on the front side of the medulla, at the back side of the, you have now positioned all the centers, okay? 4 centers are mawjood, and these centers are doing something to control the respiration. Now we will apply the questions, okay? All right, how are these centers controlling breathing? Are all centers working all the time, or some makhsus centers are working for some area, something, and others are working for some other thing, like this? So logically, we have to have some logic in mind, okay? All 4 centers are not really doing a great job all the time. You are not needing all 4 centers, okay? How many types of breathing do you have, Shabab? 2. No, that is the phases of breathing. The types or the modes of breathing. 2 types. What are these? Okay, you say in this way, one is voluntary, involuntary, I take it. But, okay, in relaxed state and in exercise state. Now I give the name. Normal, quiet breathing. Right now, what are we having? Okay, and, or I'm playing or running or having strains, so forceful. Sir? We have to apply that in normal quiet breathing, how is our tanaffus controlled? And when we are doing exercise or doing forceful breathing, what happens to our control? Okay? So are you getting the picture? One by one. Awwal, the normal quiet breathing. Okay? Are you familiar with these 4 centers? No problem? Now, question is, how can you make the link between these centers, okay, and your respiratory system? Can you make connection? I want the connection. Your idea. Nerves. But how? Give me the pathway. Anything in your mind. You are in the brainstem now. Okay? You are in the brainstem. Sir? You have to reach your muscles, yani diaphragm and intercostals. How will you reach your muscles? Can you tell me the pathway? Okay, through the spinal cord you are saying. Alright? Good. So it means your Markaz is sending the fibers down into the spinal cord. Are these fibers going directly outside and controlling the muscles, or these fibers are going down and controlling the neurons of the spinal cord, and the neurons of the spinal cord are controlling the muscles? What is your idea? Okay, logical thinking. Your upper neurons of this Markaz are controlling your lower neurons of the spinal cord. Okay? Then spinal cord neurons are the motor neurons, they are controlling your muscles of respiration. Yani in this way, you are reaching the muscles. Okay? You got the pathway also? The efferent pathway? Okay. Because this pathway is not shown here, that's why I was asking you. Okay? This picture is showing you the pathway. Can you see the pathway, Shabab, here? In this picture, is spinal cord shown in this picture, yes or no? No? Maybe it's not clearly maktub, but if you closely watch, is it there? Spinal cord is there. What do you think about this part? This is brain, medulla, okay? And what is this part? Spinal cord. It's maktub here also, but very light. Maybe you have not seen it. Spinal cord. Do you see that? Okay? So spinal cord is there. Now you see the picture. Please Can you see the picture? And I want you to comment on this picture. Looking at this picture, first of all, you see, I'll ask you a question, you just observe and answer the questions, okay? Now, the first question is that my left side of the body, okay, is it controlled by my same side of the markaz or the opposite side of the markaz? The fibers are changing and then they are controlling it, isn't it? Okay, they are crossing in the spinal cord or in the brain and they are coming to the opposite side of the spinal cord. Do you see that? Okay, this is the first thing you note in the picture. Okay, now the second thing is that are your neurons of the markaz, they are sending fibers and these fibers are controlling the neurons of the spinal cord, yes or no? Yes, you can see it in the picture. Is it there in the picture? Any part. See this part, your markaz sending the fiber to the opposite side, and these are coming and these are the neurons of the spinal cord. So are they controlling spinal cord neurons? Look in this picture also. Are they controlling? Yes. These are the neurons of the spinal cord. Okay? Do you agree with that? Okay. Third thing. What do you see in VRG? What is so different about VRG? What is shown in the VRG? VRG. Two areas, two different areas are shown. Sir? One shown with akhdar and one shown with ahmar, right? Red and green color. Why? Yani now from this information you are getting one idea that your VRG has two functions. It is controlling some part of expiration and it's some part of it. Okay? This is information. Without knowing anything, you can get this information from the picture. Alright? Okay. Alright. From this picture, Khalas, that's it. Okay? Let's hold on for now. We'll talk more about coming pictures. But you got some idea that markaz is maujood where? In the brainstem, medulla and pons. Okay? This markaz is controlling your spinal cord. Okay? By crossing on the opposite side. And then your spinal cord is controlling your diaphragm and your muscles, other muscles of respiration. Okay? You know the color codes also, Shabab. What color is ahmar showing? What color is akhdar showing you? Okay. Now, your VRG is inspiratory and what do you think about the DRG? Right? So, I am moving to the next slide with this information that DRG is only for and VRG can have two functions. Alright? Okay. Let's go. The names of the pontine centers, you know, pneumotaxic, apnoestic. Name of the medullary centers, you know it, DRG, VRG. Okay? Pneumotaxic center. Okay? I'll begin with this one. Okay? Then I'll go back to pneumotaxic center. DRG. What color was DRG? What function was DRG? Hold it now. Our normal quiet breathing right now, our tanaffus is inspiration and expiration. Sir? Our inspiration is active process or passive process? Active. Our expiration is? Forget about expiration. Okay? You need muscles in inspiration. Sir? Your markaz is controlling the muscles. DRG begins your inspiration, your badaya of inspiration. This beginning and carrying of inspiration is controlled by DRG. So if I ask you, which is the main center during normal breathing which is controlling your inspiration? Khalas, the answer is DRG. Okay. But after some time, you know, when I take a deep breath, bas, that's it. And after 500 ml, I stop. Okay? So the DRG stops. DRG activates your inspiration for a little time and then it stops. Why it stops? Why? Because there is, your cage is mawjood, there is a limitation, but it is not stopped because of, mechanically because of your rib cage. No, no. You have another markaz mawjood, okay? Just like that, I switch on one markaz like this, DRG, and DRG is working. I say, okay, now I switch another one, and this markaz will switch off the DRG. So if I want to switch off the DRG, the closing switch for the DRG is which markaz? Pneumotaxic markaz. Now will switch off the DRG function because pneumotaxic is controlling the DRG. Okay? DRG is controlling your muscles and your DRG is controlled by pneumotaxic. Am I clear about that? Okay. So your normal tanaffus inspiration is happening because of the VRG and your inspiration stops or ends due to which markers? Thank you very much. Okay. So if your pneumotaxic center works quickly or it closes the switch early, what will happen to your tanaffus? Rate will increase. Okay, the frequency will increase. Like this, okay? So in Wahid minute, you will have more cycles of respiration, isn't it? Okay? All right. And if my pneumotaxic is working more quickly, so what will happen to my tanaffus? Increase rate. And what will happen to my volume? Slightly decrease because I am doing it quickly and not deeply. So tidal volume will decrease. Did you get that? Okay. All right. So, Shabab, in your normal breathing, I need two centers and tell me how is your normal breathing going on. Inspiration, DRG. Stopping of inspiration, expiration, passive automatically. Now, new cycle of inspiration, DRG again active. Stopping of that cycle, pneumotaxic. They keep on changing like this. Close on off, like this, and it goes, okay? So your expiration is passive. This is very simple. So our normal tanaffus is very simple. How many centers required? That's it. So all four are not really needed basically. Mainly what two centers are required? Maybe other centers are doing a little job which we are not sure about, but your main control is coming from, yeah. Come on. Good. Now, let us talk about exercise, forceful breathing, whatever you are doing when you are more active and you need more muscles. Okay. Now, what will happen to your inspiration? Is it active or more active? What has happened to your expiration? Is it passive or active now? Active. So both phases are active. One is more active, other has now become active. Do you that? Okay. Now inspiration. For inspiration to be more active, do you need more muscles or less muscles? More. Extra muscles. So you need more control coming from the center. Your DRG is already working, alhamdulillah. But now you need help. Which center will give you the help? VRG. So VRG was not working in the normal breathing. It was silent. It was not needed. But now you need more power. Your DRG is working and your VRG will support DRG. So they work together. When they work together, all the muscles of inspiration are working. Accessory muscles also are working now. Did you get the idea? So in your forceful expiration, two centers are working in your inspiration. What are these two centers? DRG? Yeah. So your effort will become more like this, but your effort stops. Now you're stopping that effort. So what is happening? Pneumotaxic is also working because it is needed. So now to stop the inspiration, what is the third center which is working? All right, okay? It's pneumotaxic center. But in your exercise, the fourth center is also coming in picture, and that center is called apneustic center, okay? It may also have some role. We are not sure about that, but maybe it has some role. What? Apneustic center is a center which is موجود in the lower pons. Do you remember that? It is connected with the pneumotaxic center and it switches off, the pneumotaxic center. Pneumotaxic center is switching off inspiratory center, okay, DRG, okay? And apneustic is trying to inhibit or switch off which center? Pneumotaxic center. If I have the work of the apneustic also موجود at that time, what will happen to the activity of the pneumotaxic center? Slightly decreased. So what will happen to the toll of inspiration? So it will cause a deep inspiration, isn't it? The toll of inspiration will increase, because if pneumotaxic is normally stopping it here, and if apneustic is working, it will stop it mumkin here like this. So your breathing will become a little deeper, all right? So in exercise you have a combination, okay? Now this is inspiration. Again, for inspiration in exercise, how many centers are working? What are these centers? Okay. Which center is trying to stop inspiration at the end? And which center is changing the activity of the pneumotaxic center? Apneustic. So all four are working in that phase, isn't it? Okay. Apneustic is trying, it is not completely stopping the pneumotaxic, but it is trying to inhibit or decrease the activity. Okay. Some role is there. We are not sure about the exact role of the apneustic, but if I say that, give me three centers which are definitely and very importantly working in your inspiration of exercise. Three centers which are very, very important. Awal, VRG, and three centers which are lazim for the whole control of inspiration till its end, till its akhir part end. VRG, DRG, pneumotaxic. Pneumotaxic activity is changed by the apneustic, but the main still is pneumotaxic to stop. Okay? Three. All right. Now you are expiring like this. Expiration. In expiration, this is active now. If it is active now, which center out of these four is helping expiration? VRG is the Wahid center which is also active in forced expiration. Did you see the parts, the green color parts above and below? Now they will become active and they will control the muscles of your abdomen and your depressors of the ribs also, okay, to bring about expiration. And it means during expiration of the exercise, there is Wahid center which is very important. And what is that center? So on one side in inspiration you have three centers and maybe four centers also working, and in expiration there is only one center which is working. Did you get the idea? Now you can compare normal breathing with the exercise breathing or the forceful breathing. Am I going all right? You are understanding that? Okay. All right. This is the control. Same thing which we have discussed, the nerves which are supplying the muscles. Okay? No big deal really. You will not find anything special in this picture. It's okay. This is about the control. The centers are connected with each other. The cerebral cortex is connected with the medulla. The pons and medulla are also connected, and the medulla is controlling the spinal cord mainly for the control of muscles. All right? This is the picture. No big deal. Cerebral cortex role we already know. Okay, I told you about in the beginning. One type of tanassu, voluntary. Okay, it's coming. When you want to control or hold, when you are talking, when you are eating, when you are holding your breath, when you are going underwater, in some special conditions, this system will work and you use it. Okay? Chemical control of respiration. The nervous control is khalas. That was easy really, isn't it? Okay? Chemical control. Now, chemoreceptors. When I say chemical control, definitely you will talk about chemoreceptors. Chemoreceptors for respiration are موجود in two areas of the body, Shabab. One area you already know, which you did in your CVS. What is that? Peripheral chemoreceptors موجود in aortic bodies, carotid bodies. Okay? Now, I would like to know how much do you know about aortic and carotid bodies. Okay, mashallah, you have done, you have passed through ikhtibar also. So what is your information? Aortic bodies and carotid bodies, what are these little bodies of structure? Where are they موجود? Arch of aorta. Okay, very small, millimeters, in few millimeters at the back side of the arch of aorta, a little bodies hanging. Okay, like a very little anab. Okay, like a grape which is hanging, okay, but a very little size, so a size that you will miss, but you can see, oh, this is little structure, a nodule-like structure, this is the aortic body. Okay, aortic bodies are present here. What do you say about the carotid bodies, Shabab? At the bifurcation, okay, at the bifurcation of the external internal carotid artery, you have a little structures موجود attached, okay, and these are, yeah, carotid and aortic bodies. What is so special about them? You have read them. How do they measure oxygen? Pressure? Which pressure, my dear? By partial pressure, you are saying. Oh, he's saying they are checking the pressure, partial pressure of oxygen. So they know about the partial pressure. How do they know about the partial pressure? They are the bodies. Mawjood barra. It's not inside. Stretching? They are not baroreceptors, they are chemoreceptors. What will stretch do to them? Nothing. Alright, I agree with you. They measure carbon dioxide, they measure oxygen partial pressure. I don't disagree with you. You are right. How? True? Perfusion? Who is saying that? Very nice. Perfusion. Okay? The key word is perfusion, Shabab. If anyone asks you, you are a medical student, and you say, give me that area of the body, that tissue of the body, which has the maximum blood supply or the best blood supply per minute, which area of the body will come in your mind from head to toe? Brain, definitely, isn't it? Then you say, oh, kidney also, very rich blood supply. Brain, yeah. Okay? No, your answer is wrong. It's the aortic and carotid bodies. Okay? Look at their wazn, look at their size, and look at the amount of blood they are directly getting from aorta and from the carotids. They are supplied by a little branch, direct supply, direct perfusion coming. Remember, the best perfusion in the body, if any tissue is receiving, according to its wazn, that is not your brain, that is aortic and carotid bodies. After that, your brain comes. Okay? So the best supply is coming for, they receive such a good blood supply. And why do they want blood supply? What do they want to check? That's why they are mawjood just outside the artery and they are directly connected with the artery, isn't it? That's why Allah has kept these bodies attached to your arteries directly. Always think why this is mawjood in this situation. This is the reason, okay? To get the maximum, the best blood supply. Did you get that? There's one point about bodies. Now what is mawjood inside the bodies? Very quickly. Inside the body, what is mawjood? Blood is coming, but what is mawjood? Receptors. Chemoreceptors? Yani some cells are mawjood and these cells are acting as chemoreceptors. What do you call them? Chemoreceptors. Okay? Right. Can we see a diagram? This is the situation of the bodies. You have seen this diagram in anatomy, right? And in physiology also. No, this one. Look at this section. Have you seen this diagram before? Now you see the diagram. This is the carotid body or the aortic body from inside. Mukhtalif cells are mawjood, some big cells, some small cells, some supporting cells like this, as you do in histology. Well, you are looking for a cell which is called type 1 cell, and these are Banafshi cells. Can you see the purple color here? These cells are type 1 cells. These are your chemoreceptors. Okay? The other cells which are mawjood are supporting cells. Okay? These cells, type 1 cells, they have the sensory nerve endings. Do you see the sensory nerves? They are going from there. Okay? Which sensory nerve is taking impulses from aortic bodies, Shabab? Which? Thank you. Vagus nerve. Okay? Which nerve is carrying the information from the carotid bodies? Glossopharyngeal nerve. Lovely answer, thank you. Yani two nerves are carrying the information from aortic and carotid bodies, and these nerves are taking the sensory fibers to the brain, the markaz. The markaz is the istiqbal desk of DRG. Here, medulla, DRG, one part is istiqbal, where these fibers are giving information. Okay? There. Did you get the idea? So chemoreceptors are connected to or giving information to the sensory fibers, and the sensory fibers are going in the nerves to your brain, yani markaz. Which markaz? Medulla. In medulla, which markaz? DRG. Because DRG is the main center which is bringing about the control. Okay? Is this diagram clear? Okay. All right. One set of chemoreceptors I told you, these are called, now what do you call these chemoreceptors? They are mawjood in your vessels and they are going to your center. Are these peripheral or central? Khalas, they are peripheral, okay? It means there are some special central chemoreceptors also mawjood, and they are directly mawjood in the brain. You have DRG, okay? Medulla. Just touching GRG, you can say Bajawar, exactly, in the neighborhood, just very close to it. You have a little area, and that little area is called chemoreceptor zone. Yani some chemoreceptor neurons are mawjood in that area. This area is connected to DRG. Okay? This area will send direct information to DRG because it is very, very qareeb, lying touching really. Okay? Your peripheral chemoreceptors are connected by the nerves to the DRG. Sir? Your central chemoreceptors are taqriban directly connected by neurons to the DRG. These are central chemoreceptors, these are the peripheral chemoreceptors. Both are sending information to your markers, and the markers knows about the whole body picture. What is happening to oxygen, what is happening to carbon dioxide, what is happening to hydrogen ions. Three things, three controls. Oxygen, carbon dioxide, this is the whole story of your respiration. Okay? Now, tell me one thing. Your peripheral receptors, okay? What is the stimulus? You told me, you gave me the stimulus, you too gave me the stimulus. You said oxygen, okay? Partial pressure of oxygen, it checks your aortic and carotid bodies. You said carbon dioxide levels. Can you add one more thing? Yeah, all three things are checked. Awwal is oxygen, and then you have CO2 and hydrogen ions, because CO2 is also making the hydrogen ions, you know that. Okay? Anyway, these are the stimuli. Okay? And this information goes by the nerves. Do you think that you are sending information of the blood gases? Are these gases directly telling the brain, or through the peripheral chemoreceptors they are sending the message? To the peripheral chemoreceptors, okay? Now, all right. The central chemoreceptors, they are मौजूद in the medulla. Okay? They are sensitive. Now we'll talk about the central chemoreceptors. The question is, how can you stimulate the central chemoreceptors? This is a question. Central chemoreceptors, how can you stimulate them? CO2, you're saying. Okay. All right. Oxygen, this is the second option. What could be the third option? Hydrogen. Now, we have to select, do all these three things affecting the markers? Okay. You're saying carbon dioxide. All right. All right. All right. Now, hold on. You are in the blood. In your blood, carbon dioxide is increasing or decreasing. Can this carbon dioxide tell your central chemoreceptors that I am increasing or decreasing? Think logically and answer. Why are you saying no? If you are saying no, why? Okay, they are sending information. All right. Then what do you think will be the use of central chemoreceptors? If peripheral are doing the job, yani they are telling oxygen, carbon dioxide, hydrogen, everything, then why do you need the central chemoreceptors? Yeah? Important for the brain. Okay, but how do they inform brain that what is happening in the body? Well, Shuf, your changes are happening in the blood. Sir? Your changes are happening in oxygen and carbon dioxide in the blood, increasing, decreasing, hydrogen ions, okay? How will the brain know about it? Awwal, peripheral chemoreceptors. Sah, great, okay? But what is your central chemoreceptor doing? What thing is it stimulating? You have to decide. Carbon dioxide of the blood, yes or no? It's a mixed response coming. Now, okay, let's start the story and put the thread from here. Your carbon dioxide is a lipid soluble gas, yes or no? Yes. It is a very fast moving gas. It can go everywhere. Can it pass through the blood brain barrier? Yes or no? Can it enter into the area of the medulla and in? It can. And can it reach the chemoreceptors which are maujood in the center? It's mumkin, sir, because of its property. So carbon dioxide is going directly. Carbon dioxide is going and informing about itself that I am maujood, I am more, I am less. Okay? So carbon dioxide can go. So can carbon dioxide stimulate? Yes or no? Yes, yes it can. Okay? How? We will tell. Think about hydrogen ions now. Okay? Hydrogen ions maujood in the blood. pH. Okay? Hydrogen ions are passing into the brain. Can they enter the brain? No. Why? Blood brain barrier maujood, and they have a charge, ionized, H ion plus charge, and hydrogen ions cannot cross the blood brain barrier, as you're saying. If they cannot cross, can hydrogen ions stimulate central receptors? No, out of question. Oxygen. Oxygen is a lipid soluble gas. Oxygen can go and oxygen can reach the central chemoreceptors. Okay? It can also tell. So now out of 3, how many stimuli are you using? 2. Okay? From the blood. From the blood. I am saying from the blood, please. From the blood. Oxygen and carbon dioxide. Now you are comparing carbon dioxide and oxygen. Which one is more important? Carbon dioxide or oxygen? Well, yani, less oxygen is more important or high carbon dioxide is more important out of these 2? We have to decide one. Both are doing the job, but which one is better job? More carbon dioxide or less oxygen of the blood? It's more carbon dioxide. Yani, your main stimulus now, your answer is, if you say Wajed, most important thing, okay, carbon dioxide. Okay? And after that, little effect of, okay. Is that clear? So if I say, my blood carbon dioxide can stimulate the central chemoreceptors, yes or no? Yes. My blood hydrogen ions can stimulate my center. No. My blood oxygen low can also stimulate my center, yes or no? Yes. My blood oxygen when it is low can stimulate my central chemoreceptors, not equal to carbon dioxide, but they can stimulate to some extent, yes or no? Yes, okay, it can. So the most important awwal is CO2, alright? Are we clear about that? Please hold on. when the carbon dioxide goes inside the brain, the markers, okay, some carbon dioxide also goes in CSF, your fluid, and some carbon dioxide is موجود in the central chemoreceptor area where neurons are موجود. In that area, you have a very special enzyme called carbonic anhydrase. What do you remember about that enzyme, Shabab? This enzyme changes the carbon dioxide into what? Yeah, carbonic acid, and then into one bicarbonate and one hydrogen. Forget about bicarbonate here now. Think about hydrogen, okay? This hydrogen, is it a Jadid hydrogen formed here, or it's a hydrogen coming from the blood? What do you think? It's a Jadid hydrogen, okay? This Jadid hydrogen is Shadid in its action. It is so powerful and intense that it stimulates your DRG maximally. So, what is your carbon dioxide doing when it goes inside your brain? It's changing into which ion? Hydrogen. And what is hydrogen doing? Now, I ask you, the carbon dioxide of the blood is directly stimulating the DRG, yes or no? Carbon dioxide of the blood is indirectly stimulating your chemoreceptor area or the DRG, yes. Your hydrogen ions are directly stimulating, which are formed in the brain, are directly stimulating your DRG, yes or no, or the chemoreceptor, right? So did you see the difference between the two hydrogen ions? One was Qadim, which was موجود in the blood, and one is Jadid, new, fresh forming in the brain, okay? So carbon dioxide is using hydrogen ion, but this hydrogen is formed where? In the brain. It is not outside, okay? Carbon dioxide can also form hydrogen ions in the blood, but can these hydrogen ions go into the brain? So hydrogen ions in the brain, when they are formed, okay, in the brain area, CSF or the brain area, they will stimulate the markers. Now, Shabab, after this discussion, I say, I want the tarteeb of the stimuli, according to everything which you have discussed, tarteeb of the stimuli, okay, according to tarjih actually, number 1, number 2, number 3, now you give me the order which are stimulating your central chemoreceptors. Number 1, hydrogen ions now, okay, number 2, CO2, number 3, thank you, did you understand that? Okay, clear to everyone, Shabab? Okay. Now, same thing reaction in the brain. When it goes, it changes into hydrogen ions, and hydrogen ions will stimulate the central chemoreceptors and they will stimulate the DRG, inspiratory center, okay? This formation of hydrogen ions is happening in the brain tissue and in the CSF, and these are stimulating your central chemoreceptors. So now you know the farq of your peripheral chemoreceptors and central chemoreceptors. For peripheral chemoreceptors, number 1, oxygen. Number 2, carbon dioxide, hydrogen, okay? For your central chemoreceptors, number 1 is Jadid hydrogen ions. Don't say just hydrogen ions because I'm confused. Say hydrogen ions which are formed in brain, okay? Number 2, it's carbon dioxide, and number 3, I hope it is clear to you and you have compared the basic stimuli. Great. Okay. We have done it. We have done it. We have done it. Oh, 1 point. Just 1 point. Just 1 point you add. You are comparing aortic and carotid bodies. Which are working more and which are more sensitive? No. No. Look at carotid bodies. Okay? You think aortic bodies, mumkin, they are more strong or they are working more. They are working good, okay? But carotid bodies probably are more sensitive, and they are sensitive to the oxygen, low oxygen, which is dissolved oxygen. They are, very interesting question. When you are saying low oxygen, you are saying, you said partial pressure. When you say partial pressure, are you talking about the hemoglobin oxygen or dissolved oxygen, sir? So you are talking about dissolved oxygen. Everybody understands now? Okay. Look at the stimuli. Low oxygen, high carbon dioxide and low pH. All these are stimulating your carotid bodies. But when you come to aortic bodies, you will see, okay, oxygen low, yeah. Carbon dioxide high, yes. But hydrogen ions, very little response to hydrogen ions. So overall, if you compare carotid and aortic, which one is working more or better? Got it? Okay. Carotid stimulated by all. Low oxygen, high carbon dioxide and more hydrogen ions. Aortic bodies, low oxygen, high carbon dioxide, bus. That's it. So there is a difference. Okay, no problem. Please compare. Now you are comparing your central and peripheral chemoreceptors. Central, you know. Peripheral, you know. Central are working through the diffusion, carbon dioxide and oxygen. They are going into the Marcus, okay? Peripheral are working according to the nerves. Okay, the nerves are going. If I say, which system, please listen to me and answer it very clearly, very logical answer. You are comparing peripheral and central system. Okay, which system will act quickly or sari? It is more quick. Peripheral or central? Central? Give me one answer. If you are saying central, okay, give your justification, reason. If you are saying peripheral, give the reason. Yeah, peripheral are going. Yeah, but peripheral is going from the nerves. Okay, nerves are like kaharba, isn't it? This is slow, but because these are tube lights. But if I switch on the other lamba, okay, the moment I touch it, it's on, isn't it? It's kaharba action. Nerves are working like this. If I open a tap, okay, which has a pipe and the water is going on the other end there, if I open it, will the water go in 1 second to that area or fraction of a second? It will take time. So if you are working through the blood and the blood is reaching the brain and the brain is diffusing the gases and the gases are changing and they are acting, this system will take more time or your kaharba system will take more time. The blood systems, huh? So peripheral receptors are more quick or the central receptors are more quick? You got the point? Okay. Now, quickness, yes. Which one is quick? To begin. So awwal, which starts? The peripheral. And now, if you are talking about the overall power of the system, control of the system, which system will be more important? Central or peripheral? Look at there. How much? 80% and 20%. But if I say no, which one is quick? First starts. You got the point? Good. Response is very cool. What are you doing? When you have these stimuli, you will stimulate the DRG. Okay? The DRG will increase the activity. If the activity increases, what will happen to your tanaffus? Increase. What will happen to your oxygen which is coming into the system? It's more. So hypoxia is removed and the person has more ventilation. That was very easy. I'm not going for that. I'm quickly, because we are just finishing. We have few more slides. Okay? Till here, everything is clear? No problem? Great. You just discuss things with me. It will save your preparation time in exam also, because if you understand and if you just quickly answer, it's no big deal. You can answer the questions very easily. Okay? Now, there are some special receptors موجود. Other receptors, mechanical receptors, mechanoreceptors. So far we talked about chemoreceptors, okay? But you know, in the system, mechanoreceptors are also موجود. They are checking the stretching, okay? Stretch receptors, mechano. They are موجود in the system. Some receptors are rapidly adapting. They work but then become slow. Some receptors are slowly adapting receptors and they work for a long time. They work for a long time. You know what is the meaning of slowly adapting and rapidly adapting? No. When I say rapidly adapting receptor, adaptation means the function of receptor is coming less. Adaptation means now the function is slowing down. And slowly adapting means, or poorly adapting means, they are working a little for a long time, working and working and working. So if the receptor is continuously working, is it a slowly adapting receptor or a rapidly adapting receptor? Slowly. And if a receptor works and then stops, it is rapidly adapting receptor. Okay? Alright? For example, touch or receptors of sham. Okay? When you go to a new place, you smell that, you're catching a good smell or a bad smell very quickly. Okay? But if you stay for that, after few seconds that smell decreases. Okay? It is mawjood, but you will not sense it because your receptors are adapting, isn't it? Okay? You are wearing clothes, okay, touching your skin, jild, but after wearing clothes you forget about the clothes because your touch receptors are adapted very quickly, isn't it? So if I said quickly adapting receptor means they adapt very quickly and they lose their function. Now they are not working much really. Okay? So I don't feel the touch very much really. Do you really think about your clothes all the time? No. Okay? Even though they are touching. But when you come out and take bath from the bathroom and then you start dressing yourself and wear the clothes, at that time when they are touching, you feel the touch. But after some time, this touch has decreased really, isn't it? So rapidly adapting receptors. So please, just like that, you have rapidly adapting and slowly adapting receptors mawjood in your respiration also. Rapidly adapting means their function will stop quickly. Slowly adapting means long time, tawilul the function, it goes on and on and on. Okay? So which receptors are working more, slowly adapting or rapidly adapting? Okay, good. Thank you very much. That is what you need to know. SARS, when I say SARS, what is the meaning? Slowly adapting receptors. When I say RARS, rapidly adapting receptors. SARS, RARS. So there is a reflex in the lung, okay, it's called Herring-Brewer reflex, which is stimulated by SARS. The receptors are SARS, okay? So overstretching of the lungs. When I am filling my lungs very quickly and stretching my lungs, okay, my nerve endings of the lungs are stimulated because the lungs are stretching and there is a chance of damage. Okay? So the impulses go to the markers and the markers stops inspiration, you know, and all of a sudden my pneumotaxic center will become very active and what will happen? I will stop inspiration. So when I am breathing very deep, quickly, okay, a special reflex starts and that is called Herring-Brewer reflex. Receptors are slowly adapting receptors and they are working for a long time and they tell the medulla, please stop, and pneumotaxic center will be activated and will stop your inspiration. Okay? So this is called Herring-Brewer reflex. Remember that point about the Herring-Brewer reflex. So if I say Herring-Brewer reflex, is it a good reflex or a bad reflex? So is it protecting the lungs? Is it protecting the lungs from stretching or from collapse? You are like this. Stretching or collapse? What do you think? Stretch, overstretching and damage. Clear? Okay. All right. During exercise, when you are breathing deeply or when your lungs are stretching, this reflex prevents your lung from getting too much big really. Okay? So this is a good one. It is also active in your infants, in maulud or in young, okay, and their breathing is also controlled because their tanaffus is quick. Their tanaffus is also controlled by the Herring-Brewer reflex. Normally this reflex is not occurring in us. We are sitting, we are working, not zaruri. But when our chest becomes expanded very quickly, then this reflex is mawjood and it will save. Okay? There are some receptors, irritant receptors, which are maujood. Now these receptors are RARS. They are maujood between the bronchi and the bronchioles, their walls, outside between the alveoli, they are maujood. Okay? But these receptors are RARS, rapidly adapting or slowly adapting? Rapidly. Okay? So they are sensitive. They are used in coughing, sneezing, bronchoconstriction and airway secretion. Yani, they are maujood in the wall of airway. Okay? If the airway becomes small in size, these are stimulated really. Okay? And they tell about that. And then there is some bronchodilation or tanaffus will change. Okay? Secondly, if there is mucus secreted more, okay, they are sensitive to mucus and they are stimulated and they will tell brain about that some obstruction is coming. So the response of the brain is to increase the tanaffus and bronchodilation. Okay, that will be the response. All right. They are maujood outside also. They are maujood outside the bronchi and the alveoli. Okay, and if there is some stretching of the outside areas, they are stimulated. Coughing and sneezing. Okay, like when I cough, like this. In coughing, all of a sudden there is stretching. Okay, so these receptors are stimulated and they inform the center. So during the coughing, during sneezing, or during some obstruction inside, or during bronchoconstriction, these are stimulated and they tell the medulla, okay, and inform the medulla about the position of the lungs. These are called rapidly adapting receptors stimulated by irritation. Okay, and they are like stretch receptors because mechanically stimulated receptors. Okay, during coughing, sneezing, bronchoconstriction and increased secretion. One more group of receptors Shabab maujood called J receptors, juxtapulmonary receptors, J. Okay, they are maujood in the areas outside the alveoli or outer walls of the bronchi and bronchioles. Okay, and they are stimulated by edema. Okay, when there is increased fluid in the lungs, these receptors are stimulated. Okay, these receptors are stimulated by edema like fluid when edema is developing in the lungs and the lungs are stretching inside because of edema. Then J receptors are stimulated and they tell the brain that fluid is maujood and the brain will try to increase the ventilation. Okay, hyperpnea or increased. You call it J receptors. Okay, so we did three types of receptors. Herring-Brewer reflex receptors, slowly adapting. Number two, yeah, rapidly adapting receptors, but those receptors were irritant receptors. Huh? Irritant. Coughing, sneezing, bronchoconstriction or mucus secretion, something like that. Okay. Third group of receptors is J receptors, juxtapulmonary receptors, and these are stimulated by edema and the response is okay. There are some more receptors. We are not going for those details, just forget that. All right. Some more receptors are stimulating your tanaffus, markers, your joint receptors. Did I talk about the joint receptors in the beginning? Pain. When we have alam, all of a sudden we have some pain developing in the body. You see that person who is in pain, okay? His breathing becomes changed really, and the alam receptors are sending and giving information, and that can usually stimulate, and your breathing becomes a little more with pain. Yeah, not very deep really, but increase in the rate of breathing. Okay, sometimes deep also, but sometimes rapid breathing. But sometimes if anybody comes and give me a blow on my abdomen and I was not expecting it, what will happen? I'll keep on breathing like this, normal, or I'll increase my breathing like this, or I'll hold my breath like this. What will happen? Hold, automatic response, isn't it? Like this. This holding is coming. The pain can also stimulate the holding of the breath, and this holding of the breath is coming through which markers? voluntary cerebral cortex. This is coming through the cerebral cortex. Did you get that? Okay. Last parts we are just finishing. And effect of cold. Usually when you are feeling cold or cold is affecting your body, your tanaffus can increase a little. Okay, cold receptors are also stimulating. Sir? But Shabab, you are in your bathroom and you are taking ghusl, you are taking a bath. Okay, you are very happy and you are just adjusting the water and you open the shower very quickly. It's a winter season. You are expecting your hot water, okay, is coming, and you open la 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 and you start, and the water falls on your body. The moment water falls on your body like this. Does it happen sometimes? It can happen, isn't it? So now the cold which is coming all of a sudden, what is it doing? It is stimulating your cerebral cortex, and for a moment you are like, and then you slowly release yourself and it happens, isn't it? These are our responses which we show. Okay, so you see how cold can affect your respiration. You see how pain can affect your respiration. Your respiration can be affected by many influences or many aspects. Okay, chemoreceptors, mechanoreceptors, pain receptors, temperature receptors, and it's coming from your all sorts of different joint receptors. Everything is coming in picture, isn't it? Okay, am I clear about this picture, the concept? That's very easy actually, you will remember it, there is no problem. Thank you very much, that was it. Okay, Shabab, before you leave, one more point. Okay, this is a closing discussion, and I want you to know a few things. What do you mean by apnea? I'm asking few terms, just answer me. Apnea. Stop. Cessation, stopping of breathing. Eupnea. E-U-P-N-E-A. Eupnea. Eupnea. When you begin something with EU or E, it means normal. Your normal tanaffus. You are having eupnea right now. Okay, it's eupnea. Okay, normal inspiration, expiration, right? Apnea, you know that. Eupnea, no breathing. Okay, can apnea happen in us? Mumkin or not? Yeah. All right. When do we have apnea? And when? Holding the breath. And when? Okay. And when? Lazim. Okay. No question about it. Yeah, definitely. What else? Yeah. Yeah. What else? Yeah. Hey, Shabab, come on. Apnea. You forget. All the time when you are eating and passing the food, you have apnea for wahid second. Okay? 1.5 seconds, and then again normal, right? So apnea, eupnea, khalas, okay. Apnea can happen in pathologies also for some time. Sometimes during naum, sleep, apnea develops in some persons, okay? Okay, no problem. In other conditions also. Tachypnea. This is tachypnea. Hyperpnea.
Deep breath. Deep.
Shuf. Tachypnea. Frequency. Hyperpnea. Look, hyperpnea. Yeah, volume. But look, hyperpnea. Okay. What? Both. Actually, you have the breathing has now become amiq, really, isn't it? Deep. You are taking more deeper breathing, but at the same time its frequency is also a little changing, but mainly the deep one along with, okay, so when you combine frequency and the depth, thank you, it is great. Apnea, eupnea, tachypnea, hyperpnea, bradynia. You know the meaning of brady, come on. Slow breathing, okay? Bradycardia, just like that, bradynia, okay? You don't call it bradypnea, you call it bradynia, okay? P is maujood, but P is silent, bradynia, okay? Bradynia means slow breathing. Your frequency will decrease, all right? Are these terms clear? No confusion about that? Thank you very much. This is done, and inshallah, okay? Dyspnea means, yeah, dyspnea means a little difficulty, a little mushkil when you know about your breathing. When you, normally, do you know about your breathing? Do you think about your breathing? It's going on. But sometimes you become aware of your breathing and you have a little mushkil also. This is called dyspnea. Can we have dyspnea physiologically? No? Sure? When? Kya Shabab? You are playing Kuratul Qadam, a match. I'm sorry. We are playing Kuratul Qadam. I'm running. After some time, like this, okay? You stand and you see. And are you aware of that breathing your time? You're normal. But for some time you have a little mushkil. Then you settle down and you are a little better. At that time, do you develop that? Do you know about your breathing? That is dyspnea. This is normal dyspnea developing physiologically. And in diseases, definitely you develop dyspnea. Okay? Thank you very much, Shabab. See you inshallah. Yeah.